My name is Lara Ibanez, Country Director of Pure Earth Philippines. This year has been a great year as we push for lead-free futures. There's momentum of global pronouncements by world leaders, along with the ongoing and growing work on the ground in countries such as ours. Governments, corporations, and communities are working together to break the multi-generational cycle of lead poisoning. It is indeed possible to solve lead poisoning, and in this fight, data-driven decisions are key. We at Pure Earth have been doing our share in implementing an effective intervention strategy informed by research, coupled by advocacies and solutions-oriented multi-stakeholder programs and projects supported by our funders. In the Philippines, we have mounted the first blood lead level screening through the government's National Nutrition Survey, which yielded actionable data towards addressing childhood lead poisoning. Our National Environmental Health Action Plan now highlights this issue and the necessary interventions. We have conducted rapid market screening and home-based assessments, which determined lead levels in consumer products and sources of exposure in our markets and at home. We have served families through health assessments in partnership with the National Poison Management and Control Center and the respective local government units. And we have kept on sharing the results of these efforts to government and stakeholders, driving advocacy, awareness, and more importantly, action. From this experience, we have learned the following steps in lead interventions: collect data, share results, drive action, demonstrate pilots, so that we can optimize resources by focusing on the right priorities based on data and showcase replicable interventions from every possible angle. For example, while waiting for national institutionalization of a lead surveillance and response system, local governments can initiate lead monitoring policies and activities. This is exactly what we did with the city of Valenzuela, which passed a resolution to initiate local blood lead level screening. Valenzuela City is now being proactive in capacitating its own concerned offices and building evidence in order to inform their local policy and program development, particularly caring for the children with disabilities, and with a consideration to expand to other constituent children's population depending on the initial results and resources available. We celebrated International Lead Poisoning Prevention Week with the story of Valenzuela City, and hope it inspires other localities to do the same. Our remaining goals for the Philippines include the development of national case management guidelines for lead poisoning, a comprehensive source assessment of lead exposures, integration of lead case detection and referral in our maternal, well baby, and child visits, recognition of lead poisoning as a cost factor for disabilities and thus rendering of appropriate services. And perhaps most ambitiously, inclusion of blood lead level screening and treatment in our universal healthcare packages. At this crucial point, we issue a call to action that you too can support these worthwhile efforts. We can do more as a country and as a global community. Be a champion in the lead field. Together, we can solve lead pollution and ensure a future that is bright and lead-free.